For many years, millions of Nigerians across the country have faced a difficult choice of paying healthcare expenses directly from their pockets, exposing families to catastrophic health expenditures and pushing many into poverty. For countless households, a single hospital admission, surgery, or prolonged illness has meant financial hardship, debt, and uncertainty. Yet amid these challenges, a new vision began to emerge, a vision where quality healthcare becomes accessible, affordable, and available to every citizen without financial hardship. Driven by national reforms and the commitment of governments at all levels, health insurance has emerged as a critical pathway towards achieving universal health coverage. Across Nigeria, state social health insurance agencies have continued to expand access to healthcare services, protect vulnerable populations, and strengthen health systems. What began as a vision is gradually becoming a reality. Recognizing the need for greater collaboration, innovation, and collective action, health insurance leaders from across the Federation converged in Akure, the Ondo State capital, for a historic gathering. On the 8th and 9th of June 2026, the MAINDEN National Summit of State Social Health Insurance Agencies brought together policymakers, development partners, healthcare stakeholders, and health insurance administrators under one roof. For the first time, state social health insurance agencies across Nigeria united to chart a common pathway towards sustainable healthcare financing and universal health coverage.
Let me from the outset commend the organizers and the entire forum of CEOs, of Director Generals, if you like, of state social health insurance agencies for bringing together the brightest minds, policymakers, and industry leaders in Nigeria's health insurance. We are profoundly delighted to inform you that in the health sector of ONDO State, we have institutionalized equity and access across our communities through several landmark achievements. We understand that for health insurance to truly work, it must be inclusive. It must cater not only for the formal sector, but also for our rural communities, the vulnerable, and most importantly, our senior citizens. On this note of inclusivity, I'm pleased to formally announce the landmark policy shift by our administration to safeguard the senior citizens who invested their active years in serving our state. By that, I have approved former inclusion of retirees under the Orange Health Insurance Scheme arrangement at absolutely no cost to them. No problem, the lawyer can say. It's therefore my pleasure to officially and formally declare open the media edition of National Summit of SSHIAs, and I wish you highly productive and transformative deliberation.
Today is more than just another gathering of stakeholders. It is a significant milestone in the Nigeria's journey towards universal health coverage. For the first time, representatives from the 36 states and the Federal Capital Territory have become together under the roof with a shared purpose, ensuring that every Nigerian regardless of location, income, or social status, has access to quality and affordable healthcare.
That ONDO State is hosting this first national summit of state social health insurance schemes really reaffirms that commitment of the governor as a champion of health insurance as well as a champion of universal health coverage. In recent years, we know that the landscape of health insurance in Nigeria has witnessed a lot of change. His Excellency Mr. President Bola Ahmed Tinubu, as part of his Renewed Hope agenda, signaled the importance of universal health coverage. This was why in 2023, when the Nigerian Health Sector Renewal Investment Initiative was put in place, led by the Coordinating Minister for Health and Social Welfare, Professor Mohammed Ali Fateh, health insurance and financial access to all Nigerians played a significant role. But we were sure that this was not a journey that one agency, the National Health Insurance Authority, could achieve alone. This is something where all hands need to be on deck, and it has heralded a new way of working and partnership between the National Health Insurance Authority, the state health insurance schemes, as well as the private health insurance providers, sharing a common goal, which is to ensure that we expand financial protection to all Nigerians.
Over 2 days, participants engaged in robust discussions on health financing, digital innovation, expanding insurance coverage, strengthening primary health care, and protecting vulnerable populations. Leaders examined successes, identified challenges, and explored strategies to accelerate progress towards universal health coverage. The summit attracted distinguished stakeholders from the federal and state governments, development organizations, healthcare institutions, and partner agencies. The presentation of awards and commemorative plaques symbolized appreciation for visionary leadership and unwavering dedication to healthcare transformation.
An award presented to His Excellency Dr. Lucky Oribison Ayedatiwa, the Executive Governor of ONDO State, by the Forum of CEOs of State Social Health Insurance Agencies, in deep appreciation of your vision, the visionary leadership, and the successful hosting of the maiden National Summit of State Health Insurance Schemes on the 8th of June 2026.
CEO of State Social Health Insurance Agencies, proudly presenting this to my colleague, His Excellency Malabi Gomara, PhD, Governor of Astina State, in recognition of his visionary leadership, unwavering commitment to healthcare development, and invaluable support for the successful hosting of the maiden national summit of this agency. And this day is 8th of June 2026. Congratulations.
Thank you, Your Excellency.
I have the honor to present this vision for connected and resident solution where the board of state social health insurance agencies in appreciation of the successful hosting of the MAINDEN national summit of the health and approved by also the 8th June 2026.
Thank you, Your Excellency.
At the conclusion of deliberations, participants adopted key resolutions aimed at strengthening health insurance systems nationwide.
One of the most important takeaways to that is the resolve by the Congress or by all the 36 states of the Federation to agree in expanding health insurance coverage across the country. Some of the strategies include the domestic resource mobilization through so many ways. One of the ways is for us to intimate state governors to establish state health trust funds across the country. And another important thing is to see how we can engage with community leaders for them to take up ownership of these healthcare facilities, because we believe the custodianship of these healthcare facilities are directly the son of the soil, the owners, which were the traditional institutions, the civil society organizations, and other important stakeholders. And also, one of the most important things is for us to strengthen political commitment towards ensuring that all states of the Federation have their formal sector running. And also the fact that the recent circular that was issued by the president of this country, President Bola Ahmed Tinubu, on making health insurance mandatory is something that we have to translate it into real action. So one of the strategies we are taking is to ensure that all the public service are enrolled into the scheme, and also to ensure that those that cannot pay for themselves are being considered, by the state governments through the equity funding and through the basic healthcare provision fund. So with that, that makes more funds going into the healthcare facilities in form of capitation and fee for service. And such funds are going to be fully utilized to ensure accountability and transparency in implementing our schemes across the country. So that can give another edge, for finances to come across the health sector and make really an impact specifically to make sure that the quality of care that is given to the targeted population is really to the standards that we have set.
Now for us, going back to our states, there's a lot to be done. First of all, we should be looking at advocacy, advocating to our governors, who are the chief accounting officers of our states, to ensure that there are legal frameworks, as they ought to be for every agency, to ensure that funds are kept in trust. There should be trust fund for this, for us to be able to sustain our finances and cover more people. Of course, equity has to be paid by state. All of these have to be done through advocacy. Domestic resource mobilization is also very key. So interacting with private sector, ensuring that we collaborate to cover more people, more Nigerians, is one of the things we're going to be looking at. So there's so much to look forward to before we get to our second edition of the summit. I'm sure that every state, based on their context, will find something to take as an action point as we get back to our states.
The journey towards universal health coverage is not a destination reached overnight. It requires vision, commitment, partnership, and sustained action. The Maiden National Summit of State Social Health Insurance Agencies has laid a strong foundation for a future where healthcare is not a privilege but a right accessible to all. A future where illness no longer leads to financial ruin. A future where health insurance becomes a powerful instrument for equity, protection, and national development.
Over the next 5 years, we expect a major shift towards mandatory health insurance, significantly reduce out-of-pocket medical expenses, and targeted subsidies for vulnerable groups. The commitment made at the Maiden National Summit of State Social Health Insurance Agencies in Akure aim to fundamentally reform Nigeria's healthcare financing, and we expect that the key impact by 2021 should include compulsory coverage, where we transition from voluntary to legally mandated health insurance for all residents that will be supported by enforced state laws aligned with the 2022 National Health Insurance Act. We also expect protection for the vulnerables. Of course, we are aware that the Basic Healthcare Provision Fund program is ongoing, but we expect that there will be significant expansion of the subsidized or free enrollment for rural communities, women, the elderly, children under 5, pensioners, people with disabilities, and also sickle cell warriors. We expect a massive reduction in catastrophic out-of-pocket expenditure across board, replacing it with a mixed financing model of government equity, contributions, targeted levies, counterpart funding, adoption model, and many more. We also expect to have improved primary health care, and this will be achieved through upgraded and better funded primary health care centers across the 774 local government areas. More importantly, we also expect to have digital transparency, where we have seamless digital enrollment system and transparent insurance administration to build public trust in the health insurance ecosystem.
From dialogue to action, from commitments to implementation, the work continues. Together, we move closer to a healthier Nigeria. Together, we advance universal health coverage.